Hello everyone, welcome to our educational channel. My name is Zetu. Today I would like us to talk about the procedure arthroscopy. What is arthroscopy? Arthroscopy is the surgical procedure that is done to view the inside of the joint. Surgeon will use an arthroscope, which is a narrow tube connected into the camera through a small incision. The view inside the joint will be transmitted into the monitor where the surgeon will be able to see, diagnose, or treat whatever problem that is in the joint. Why arthroscopy is done? Arthroscopy is done to diagnose or treat the joint problems that are affecting the knee, that are affecting the shoulder, the hip, the ankle, or even the elbow. For diagnostic purposes, the surgeon will do arthroscopy if the X-ray or other imaging studies are not giving the final diagnosis, and the surgeon will recommend arthroscopy to be done so that he can get the final diagnosis. Conditions that can be treated through arthroscopy: if there is inflammation in the joint lining. Another problem that can be sorted through or treated through arthroscopy: if there is a loose bone fragment in the joint, the surgeon will do the arthroscopy to remove that bone fragment. Another condition: if there is a torn ligament, the surgeon will do arthroscopy and he will repair that ligament. And if there is a damage or torn cartilage, arthroscopy can also be done. If there is a scarring in the joint, the arthroscopy can also be done. If they are doing those procedures, they usually make another small incision so that they will be putting some other instrument through the small incision to repair or to treat whatever problem that is in the joint. Arthroscopy can be done under local anesthesia. It can also be done under general anesthesia, depending on the damage that the surgeon may be suspecting. If it's done under local, it will be easy because the patient will be admitted in the morning and may be discharged in the afternoon. If it's done under general anesthesia, the patient can also be admitted in the morning, but the patient needs to be taken into theater, of which the patient can be discharged late in the afternoon, or if the surgeon feels that the patient needs to be kept in the hospital for overnight, that can also happen. Therefore, it can be general or it can be local anesthesia. What to expect post-arthroscopy? The patient will be educated before the procedure. Pain management. The patient will be encouraged to take the pain management that will be ordered, because the pain will be there depending how bad was the damage on the knee. Rest. The patient will be encouraged to rest, and when he's resting, he must be able to elevate the area that is operated. Applying of ice. Will also be encouraged to apply ice to help to cool the area. Splinting of the area. The patient will also be encouraged to use splint, or he may even use the crutches, so that he will try to rest that area that is affected. It can be a sling, it can be crutches, or it can be anything that will make the patient comfortable. Exercise. The surgeon may refer the patient for physio, or he may refer to any other rehab facilities where the patient will be helped to start exercising the area to avoid the stiffening of the joint. All these things are prepared pre-operatively, so that the patient will be cooperative post-procedure. It is important to explain to the patient and the family what can happen. There are some complications that can happen, and the patient also needs to be informed if he feels that maybe there is some infection that is setting in. It is important for the patient to know that he can always phone the doctor or phone the clinic or the hospital where he has been treated, so that all that infection will be treated, or he will come into the doctor's rooms or in the hospital where treatment will be treated. Arthroscopy is not a major operation, but it can still have some complications that can happen. Things like infection, all that is important. That's why the patient needs to be educated, so that he will know what to do after the procedure. For today, we will end up here. And if you do like these short videos, please subscribe, comment, and share. Thank you for watching. Till next time, stay safe and stay healthy.